You know what's terrifying about the most dangerous illnesses? They don't announce themselves. They don't come with sirens or obvious warning signs. They come quietly, disguised as something completely ordinary. And by the time most people realize what's happening, it's almost too late. That's exactly what we're talking about today. There's a disease that has a mortality rate of roughly 38%. Nearly 4 out of 10 people who get it do not survive. And the early symptoms? Fatigue, muscle aches, maybe a headache. Sounds exactly like the flu, right? That's the problem. That's what makes this so dangerous. And that's why, after today, you're going to look at things a little differently, especially if you live near rural areas, spend time outdoors, or have ever cleaned out an old garage, cabin, or storage space. We're talking about Hantavirus Pulmonary Syndrome. And I want you to stay with me through this entire video, because the part about hidden risks, that's where most people, even doctors initially, get it completely wrong. Let's start with what this actually is, because the name alone probably doesn't tell you much. Hantavirus is a family of viruses carried primarily by rodents, specifically deer mice in North America, but also other species depending on where you are in the world. The virus doesn't make the rodent sick. The rodent just carries it, sheds it in urine, droppings, and saliva, and moves on with its life completely unbothered. The danger for humans is how easily this virus travels through the air. When rodent droppings or urine dry out, the viral particles become airborne. You don't have to touch anything. You don't have to be bitten. You just have to breathe in air that's been contaminated by infected rodent waste. And here's the part that catches people off guard. This can happen in spaces you haven't entered in months. An attic you open once a year. A cabin you visit in the summer. A shed at the back of someone's property. The virus can remain active in dried materials for several days, sometimes longer in cool, shaded environments. So you walk in, you disturb some dust, and without knowing it, you've inhaled something that could change everything. Now let's talk about what happens inside your body, because understanding this changes how you recognize the warning signs. After exposure, there's an incubation period, typically 1 to 8 weeks, though most cases show symptoms within 2 to 4 weeks. During this time, you feel completely fine. Nothing is off. No signal, no warning, nothing. Then the first phase hits. And this is where people almost always dismiss it. Fever comes first. Then significant fatigue. Not just tired after a long day fatigue, but the kind where getting off the couch feels like a task. Muscle aches, particularly in the large muscle groups. Thighs, hips, back, sometimes the shoulders. Some people experience headaches. Some get abdominal pain, nausea, vomiting, or diarrhea. And nearly everyone who has described this early phase in medical reports says the same thing. They thought it was the flu or a stomach bug. There is no rash, no runny nose, no sore throat, none of the typical respiratory symptoms you'd expect at this stage. And that's exactly what makes it so easy to wait it out at home, take some over-the-counter medication, drink fluids, and assume it'll pass in a few days. But here's where Hantavirus Pulmonary Syndrome becomes a completely different conversation. Around day 4 or 5 of symptoms, sometimes as early as day 3, something shifts. A cough develops. Not a dry, irritating cough. A cough that begins to feel like your chest is filling. Shortness of breath follows. And it escalates fast. In some documented cases, patients went from walking into an emergency room to requiring a ventilator within 24 hours of that cough starting. What's happening is that the virus triggers a massive inflammatory response, specifically in the lungs. Fluid begins to fill the air sacs, the alveoli, and the lungs progressively lose their ability to transfer oxygen into the bloodstream. This condition is called non-cardiogenic pulmonary edema. Your heart is fine, but your lungs are flooding from the inside. The clinical progression at this stage can be faster than almost any other infectious illness we treat. Blood pressure drops. Heart rhythm becomes unstable. Oxygen saturation falls rapidly. Patients can go into cardiogenic shock, not because of heart disease, but because the heart is being starved of oxygen by failing lungs. This is why the mortality rate is what it is. This is why early recognition isn't just important. It's everything. Now I want to get into the hidden risks, because most people, when they hear about hantavirus, think about rural America, cowboys, farms, open land. And yes, the American Southwest has historically had the highest concentration of cases. But the hidden risk is that this assumption creates blind spots. Cases have been confirmed in nearly every U.S. state. Canada has documented cases. Countries across Central and South America have their own hantavirus strains. Europe and Asia have different variants that cause a related but distinct syndrome called hemorrhagic fever with renal syndrome, which affects the kidneys rather than the lungs, but comes from the same viral family. The hidden risk number 1: suburban and semi-rural environments. Deer mice don't stay in forests. They come into garages. They nest in insulation in homes near wooded areas. They find their way into cars that haven't been used in months, building nests in the engine compartment or under the seats. If you live anywhere within reasonable proximity to open land, fields, parks, wooded neighborhoods, this is not a rural problem. It's your problem too. Hidden risk number 2: seasonal timing. Spring and early summer are the highest risk periods in North America. Here's why. During winter, rodents seek shelter indoors more aggressively. By spring, there's an accumulated buildup of droppings in enclosed spaces, and people begin doing spring cleaning, opening up areas that have been sealed and undisturbed for months. They sweep, they vacuum, they move old boxes around. All of that disturbs dried contaminated material and sends particles into the air. Some of the most well-documented clusters of hantavirus cases have been traced directly to spring cleaning activities. Hidden risk number 3: the false safety of "I would know." Most people believe that if they had a rodent problem, they'd know. But deer mice are small, quiet, and nocturnal. They can establish a presence in a space and leave considerable contamination without ever being seen by the people using that space. You might walk past evidence of rodent activity every day and not recognize what you're looking at. Small, dark droppings roughly the size of a grain of rice. Gnaw marks on packaging. A slight musty odor in an enclosed area. These are the signs, and they're easy to overlook. Hidden risk number 4: there is no vaccine and no specific antiviral treatment. This is critical to understand. If you are diagnosed with Hantavirus Pulmonary Syndrome, the only option is supportive care. Oxygen therapy, mechanical ventilation if necessary, managing blood pressure, keeping the patient stable, and hoping the immune system can fight through it. There is no medication that targets this virus. This is not a situation where you can take a course of antivirals and recover at home. Prevention is not just the best strategy, it is the only strategy. So let's talk about what actually keeps you safe, because this part is where the conversation becomes actionable. If you are going into any enclosed space, a cabin, a storage unit, an attic, an old shed, a basement that's been closed up, don't just walk in and start moving things around. Before you do anything, open windows and doors if possible, and let the space air out for at least 30 minutes. During that time, don't be inside. When you do go in to clean, do not sweep or vacuum dry droppings. This is the single most common mistake. Sweeping and vacuuming aerosolizes particles. Instead, you want to wet everything down first. Use a disinfectant solution. A mixture of bleach and water works. Roughly 1.5 cups of bleach per gallon of water. Spray down the droppings, the nesting material, the surrounding area. Let it soak for 5 minutes. Then use paper towels or disposable rags to wipe it up and place everything into a sealed plastic bag. Double bag it. The goal is that nothing dry ever gets disturbed into the air. Wear gloves, rubber or latex, not cloth. And if you have reason to believe there's significant contamination, an N95 respirator is not overkill. It's appropriate. For ongoing prevention, look at how rodents might be entering your home. Mice can get through gaps as small as a dime. Check the foundation. Look at where utility lines enter the building. Examine areas around windows and doors. Steel wool packed into gaps before sealing with caulk or foam is one of the most effective deterrents because rodents can't easily chew through it. Keep food in hard-sided sealed containers. Birdseed, pet food, grain, anything stored in a garage or outbuilding should be in sealed bins, not bags. Rodents will find a way to open or chew through soft packaging. If you find evidence of a significant infestation, seriously consider calling a professional pest control service. Not because you can't clean it yourself, but because they have the equipment and training to assess the extent of it. Heavy infestations can mean contamination has spread beyond what's visible, and underestimating that is where the risk compounds. And here's something that I think is genuinely important to leave you with. Hantavirus pulmonary syndrome is rare. I want to be clear about that. The number of confirmed cases in the United States each year is typically in the low dozens. But the nature of this illness, the incubation window, the mimicry of the flu, the rapid escalation, the absence of treatment options, means that awareness is not just valuable, it's potentially life-saving in the most literal sense. If you or someone you know develops flu-like symptoms, and there has been any recent exposure to rodents or potentially contaminated environments, even something as brief as opening an old storage space or spending time in a rural cabin, that information needs to go directly to a doctor. Not later, not after a few more days to see if it passes. Immediately. You say specifically, there was potential rodent exposure, and I want to rule out hantavirus. Those words matter. Because while there's no cure, early intensive care dramatically changes survival outcomes compared to presenting in full respiratory failure. The people who survive this disease are often the ones who either got lucky with a milder immune response or who got to a hospital before their lungs gave out. Both of those things are partially within your control. So ventilate before you enter old spaces. Wet before you wipe. Seal entry points. Recognize the early symptoms. And take potential exposure seriously. That's not fear. That's just knowing what you're dealing with.